Good afternoon and welcome to today's webinar. My name is Grace McManus and I'll be your tech support along with Katie for the duration of the webinar. This training was developed under the Substance Abuse and Mental Health Services Administration's Prevention Technology Transfer Center Task Order and is for training use only. And now I'm going to hand it over to Deborah Nixon-Hughes, the Director of the Central Prevention Technology Transfer Center. Debbie?
Thank you, Grace, and welcome everyone. As Grace said, I'm Deborah Nixon-Hughes and I'm the Project Director for the Central East Prevention Technology Transfer Center. We are located in Silver Springs, Maryland, and we're housed within the Danya Institute. Our director is Renata Henry. We are part of the Technical Technology Training Centers Network, which includes 13 centers. There's 10 regional centers, 2 national centers, the National Hispanic and Latino, the National American Indian and Alaskan Native, as well as our coordinating office. As I said, we serve Region 3, and that's the Central East, and here are the states that we provide training and technical assistance to. So what does the Technology Transfer Center do? You can see on the screen are the 4 major areas that we do. We try to accelerate the adoption and implementation of evidence-based and promising practices. We want to strengthen the behavioral health awareness, knowledge, and skills in healthcare and the prevention workforce that addresses the needs of people with behavioral health disorders. We want to foster regional and national alliances among culturally diverse practitioners, research, policymakers, funders, and the recovery community. And we want to ensure the availability and the delivery of publicly available, free of charge, and of behavioral health training and technical assistance to the healthcare and prevention professionals. Here's our mission, and we work to strengthen the capacity of the workforce to deliver evidence-based practice, while at the same time facilitating opportunities for preventionists to pursue new collaborations, which include developing prevention partnership and alliances. Every Prevention Technology Transfer Center is required to identify a specialty area, and we have identified engaging in collaborating with primary care providers for substance use prevention. It's just a natural pathway, particularly around issues around stigma. Here's our eligibility requirements for our training and technical assistance. And as you can see, we try to look at local needs or national needs. We coordinate with those entities. It's no cost, data-driven, and we provide evidence-based practices provided by subject matter experts like we have today. Here are the focus areas that the Central East PTTC focuses on. Here are some of our upcoming webinars that you saw for those who entered the lobby early. And as I said, we are fortunate enough at the Danya Institute to house all 3 training and technology centers, including the Addiction Technology Transfer Center that's led by Holly Ireland, and the Mental Health Technology Transfer Center that's led by Oscar Morgan. So today we are examining the social determinants of health, a prevention perspective, and our speaker today is Dr. Dawn Thomas. She is currently a prevention system manager with the Ohio Department of Mental Health and Addiction Services. She has more than 25 years of public service that's focused on prevention, training, mental health, and other social service programs for adults as well as students. Dr. Thomas is an Ohio certified prevention consultant with a PhD in health education from the University of Cincinnati. Without taking any additional time, I'm going to turn this webinar over to our distinguished speaker, Dr. Dawn M. Thomas. Dawn?
Good afternoon, everybody. I'm really excited to be here with you today. I see that we have quite a few participants, and we have quite a big agenda ahead of us, so I'm going to go ahead and get started. So today, for our learning objectives, what we want to do is we want to take a look at, I'm going to provide you with a background and overview of the social determinants of health. And then I'm going to take a look at the 5 sort of big areas or buckets around the social determinants of health. And we're going to take a look at how those impact health outcomes. We're going to talk a little bit about health equity terminology today, just to get you familiar with that. And then we're just going to review and summarize the significance of the social determinants of health and why it's really important for us to begin to consider this in our prevention and health and wellness efforts. So this afternoon, I want you to take a minute to just think about something. As you see the human body portrait on the screen, I want you to sort of think about who you are. What makes up who you are, and what are all the aspects of you? And we're going to come back to this later, so if you want, and you're so inclined, you want to try to sort of draw a human body, or if you want to do a stick figure, it doesn't matter. I just want you to jot down some notes when you think about who you are, what makes up who you are, and what are all the aspects of you. Okay? We're going to move on. So now we want to talk about the determinants of health. And really, when we're talking about the determinants of health, it's all about the context of people's lives. That's what determines people's health, the context of their lives. And this is usually social and economic environment, the physical environment, as well as a person's individual characteristics and their behaviors. And what's important here is to know that we all come to the table with biology and gender and a genetic makeup. But it's the social context of our lives that really determines our health. So when we talk about the social determinants of health, what do we mean? And so what we're talking about here is generally the conditions and the places where you're born, where you live, where you learn, where you work, play, and age. And so it's really a broad range of personal, social, and economic factors that contribute to an individual's health or even community health. So again, it's the economic and social conditions that affect the health of individuals and communities. And what's really important to remember here is that these things are shaped by the distribution of money, power, and resources. So I want to start off by giving you just a little bit of background because you've probably been hearing lately a lot about the social determinants of health. And so I want you to know that these aren't new. We've really been working on these for quite some time. And so I wanted to just kind of start off by talking to you a little bit about Healthy People 2020. I'm not sure how many of you might be familiar with this. I'm probably dating myself right about now. But when I was in graduate school in the 90s, I remember being in a course and we were studying Healthy People 2000. And I remember thinking at that time, 2000, that's a long way off. Why are we talking about that? And the funny thing is that this is a federal government document, and they publish it basically every 10 years. So there was Healthy People 2000, Healthy People 2010, and now, of course, we're here with Healthy People 2020. And it's basically the federal government prevention agenda. They take a look at goals and objectives of things that we can do that are designed for people to be healthy, and they make those, the goals for the year. And so the whole issue of the social determinants of health is so important that it has now become one of the 4 overarching goals that they have for the decade. So there's only 4 goals, and the social determinants of health made it into one of those 4. And so that goal is to create social and physical environments that really promote good health for all. The other piece I want to give you historically is the World Health Organization and their role. Now, many of you may not have heard of the World Health Organization, but I bet you because of the situation we're in now with COVID-19, all of you know about the World Health Organization. And so the World Health Organization had a commission on the social determinants of health, and they published a report called Closing the Gap in a Generation, Health Equity Through Action on the Social Determinants of Health. And this report was done actually 12 years ago. It was done in 2008. Some other documents and historical perspectives are the National Partnership for Action to End Health Disparities. This is yet another federal document that really talks about the importance of the social determinants of health. It provides lots of strategies for communities to use in a framework for addressing health disparities. And then last but not least, there's also the National Prevention and Health Promotion Strategy. And I'm sure since we have probably a ton of preventionists on this call, you all are familiar with that as well. This document and the National Partnership document to End Health Disparities, both of these documents have been around since 2011. So I just wanted to give you kind of a quick perspective and let you know that the social determinants of health is really significant as we're taking a look at that in the nation's health. Now we're going to break it down a little bit more, and we're going to talk about sort of the 5 areas or buckets around the social determinants of health. And this is directly from Healthy People 2020. So I figure since they really set up the nation's prevention agenda, this will be a good one to start with. What I do want to say to you today is I don't want you to get so caught up in, are there 5 areas of social determinants of health? Are there 7? Are there 8? Because if you do research and you look up things like I do, you're going to see social determinants of health with lots of areas and primary areas. So we're going to go over them. Again, I use this because it's Healthy People 2020. I thought it was a good place to start to give you a general overview. So when we're dealing with the 5 areas, we're talking about things that have to do with economic stability, education, social and community context, neighborhood and built environment, and health and healthcare. And so one of the things I want to say is that generally when we think about determinants of health or people being healthy or not healthy, the first thing we always go to is health and healthcare. But as you can see, that's just one area that is covered with the social determinants of health. And what's important to remember is that all of these things are really interrelated and interconnected. So now we're going to take a little bit closer look. I'm going to kind of go into some explanations around some things. But what I'd like you to do, if you don't already have them on now, is go ahead and put on your prevention glasses. I want you to start thinking about the social determinants of health through the lens of prevention. So I'm sure some of you may work in schools. Some of you may do after-school programs. Some of you may do community prevention or community coalition work. So as we're going through this, I really want you to think about the work that you do in your local community. So the first topic we're going to talk about is income and social status. And this is all about how much money a person really earns. Not only how much money, but what kind of work does a person do? Because research shows that higher income and social status are linked to better health. So, therefore, the greater the gap between rich and poor, then the greater you're going to see differences in health. So income and social status is a big part of the social determinants of health. Also, employment and working conditions. So this is not only being able to get a job, but being able to keep a job. And so what we know about people that are employed is that they tend to be healthier than those that are not employed. But that really also has to do with if the folks have control over their working conditions. Now, when I think about employment and working conditions, I just kind of want to give you an example. The first thing I'm thinking about right now is our current situation with COVID-19 and employment and working conditions. And I think about the fact that it's interesting that we really look to our medical professionals and our first responders, and all of those folks are really important when it comes to situations like this. But I wonder if we've ever really thought about the fact that our folks that work at Kroger and people that are driving the bus and all of these different positions that we now consider essential would be this important to us. And so, we want to think about that when we think about the context of people's health. Education and literacy is another area. Believe it or not, how much education a person obtains is really linked with poor health. So low education levels are linked with poor health because it can lead to stress, lower self-confidence. And so also having more education is linked with longer life expectancy and the quality of health. Another area around the social determinants of health are childhood experiences. And so I know that many of you probably work in the communities, and you're probably familiar with something called the ACEs, which are adverse childhood experiences. And that really takes a look at young people's lives from like 0 to 17 and taking a look at how they develop in their first few years of life in terms of whether they're witnessing violence or abuse or they're having family members that are having certain issues. And it's all about in early childhood trying to determine whether or not young people feel a sense of safety and stability. So that is another social determinant of health, childhood experiences. Next, we want to talk about physical environment. And so when we're talking about physical environments as it relates to the social determinants of health, this is when we're talking about things like access to parks, safe sidewalks for walking. Are there places where you can do exercises? It also includes things like safe water, clean air, healthy workplaces, even safe housing. It's interesting because when I think about physical environments, I saw something the other day that talked about the fact that while we're all very concerned about the pandemic, and we should be, that Flint, Michigan has been without clean water since April 24th, 2014. I think that's something to think about when you're really thinking about the social determinants of health and how they impact people. Social supports and coping skills. So what this looks like is, are folks getting support from their families and their friends and their communities? Because social supports are linked with much better health care. Culture and customs and traditions, they also have a lot to do with social support in terms of what people believe. This can also be a situation where you have family and community rejection for folks that are experiencing or that are gay, lesbian, bisexual, transgender. They can experience a lot of rejection. Other examples include young people with bullying, things that can lead to depression, suicidal use, or alcohol use. So getting social support is really important when it comes to being healthier. Then we want to talk about healthy behavior. So this is all about where people live and eat. So one of the things that's interesting is when I talked to you earlier about the 5 sort of big areas that we've looked at, I've been noticing lately sort of a 6th area that people are focused on. And they pull out food insecurity. And so I think it's becoming such a huge issue for people that now when we're taking a look at the social determinants of health, it's almost being singled out as just a whole other single determinant of health on its own. We have more than 23 million people in the world that live in food deserts, and that's concerning. And of the 23 million, we have 6.5 million children that live in food deserts. And what that means is, is there a grocery store near you? So going back to the social determinants of health, we talked about that's where people are born, where they live, where they work, play, and age. I just want you to think in your mind for a moment for your own personal, where you live, work, born, play, and age, and how close is the nearest grocery store? How far do you have to go? These are the kinds of things that we're thinking about under healthy behaviors. Not only is there a store nearby, but is there affordable, healthy food available? Other healthy behaviors we want to think about in this category, of course, as preventionists, we would want to be thinking about things around alcohol and substance use, unprotected sex, smoking, being and having the ability to get regular screenings for physicals, and having access for routine checkups and things like that. And then lastly, access to health services. Again, a lot of times when we think about a person's health, that's one of the first things we think about is, do people have insurance and do they even have access to services? So all of these things make up the social determinants of health. Now, when we think about this, again, I want you to remember all of these things are so interrelated. And because the social determinants of health are the social and economic influences, things like race, place, and health and socioeconomic status are all intertwined. So being in a disadvantaged group, as I mentioned before, is associated with having a lower level of educational attainment. And then having a lower level of educational attainment is associated with worse health status. Also, the lower person's social group or social position, generally, their average of their health is not that great either. You see where we're kind of going with this? It's like a trickle effect. And then racial bias affects health. We know that the data says that things like discrimination, stigma, and unfair treatment in the workplace can really, really have a profound impact on a person. It can increase blood pressure, you can have heart issues, stress, and those kinds of things really undermine self-esteem and self-efficacy. So these are some of the things we want to remember, that race, place, health, and socioeconomic status are all other factors that we're dealing with when we're talking about the social determinants of health. So again, these were three of the things that I wanted you to really understand, is that the social determinants of health are impacted by money, by power, and by resources. And so this can be global, national, or local. And these things can mean you can have an advantage in terms of your determinants of health or a disadvantage. Again, the social determinants of health are those conditions that determine a person's health. I really like this image because it's a tree. I like trees, but also because when we're looking at the social determinants of health, sometimes they've just been referred to as the causes of the causes. And so it's like getting to the root of the problem. So when you look at the tree, you know a tree has to be strong in order to have strong branches, bear fruit. But if the roots of a tree are not strong, then the tree is not going to bear fruit. And so when you look at all of those pieces around the roots, those are some of the things that we talked about. You know, we're talking about access to parks and natural resources. We're talking about safe and effective transportation, strong, vibrant neighborhoods, strong economy, quality education. And so it's important for us to realize that the context of people's lives really determines their health. And I can't stress that enough. But what's really important for us to remember is that we don't want to blame people for, you know, having certain social determinants of health that work against them having good health. It's really inappropriate for us to blame people for poor health or really crediting them for good health when we haven't taken a look at the whole picture overall. Because quite honestly, we know that individuals are unlikely to be able to directly control all of those factors in their life. So what I want you to do now is just think about the discussion that we had quickly and to think about how have the social determinants of health impacted your work as a preventionist. And if you'd be willing to just put a couple comments in the chat box, that would be good. So again, put your prevention lenses on, think about the work that you do, and think about how you think the social determinants of health have impacted your work as a preventionist. Great. I'm starting to see some things come in. Thank you so much, Chelsea. Transportation, insurance. Oh, I love this. Jen, thank you. It's part of the foundation of why we have prevention work. Absolutely. Encountering people, Jeffrey says, with people without any kind of services. So focus on literacy and health literacy. Thank you, Lisa. Again, transportation, access, poverty, lack of funding for prevention policies. Oh, you guys are really bringing them in. Low-income housing, rural communities, all of these things, bias towards the unsheltered. Great. Culture, food, housing, these are huge barriers to school. No single point of entry. Thank you. So this is what I want us to begin thinking about, is how we can involve ourselves and infuse ourselves with this system. And we have a role to play, and I know that you all know that. We have a very important role to play. So thank you so very much. Not trusting the system, I had to say that. Lack of services in the community and environmental protection. These are all great. Isolation. Thank you, Maria. I think that's really important. That's a huge part of the social supports that we were talking about, especially in the world that we're living in right now. Think about that, the isolation. So thank you very much. I love this. Doctors talking down to patients. Again, distrust in law enforcement. You guys are really coming up with some great things. Thank you so much. I hope we're able to capture all of that in our chat and questions. Thank you again. So now we want to talk a little bit about, we want to make sure we understand the terminology. And please don't get me wrong. I know we have many intelligent folks on the phone, so I just want to go over terminology because I feel like a lot of times as we are navigating different systems, we want to know the language so that we make sure that we understand. So there's all this talk lately about health disparities. And so we want to make sure we understand what that is. And so basically, health disparities are all about differences. That's the simple way. They're all about health differences. But the important thing to remember is that these health differences are linked to social, economic, and environmental disadvantage. And so what we also want to remember is that health disparities adversely affect groups of people who have systematically been excluded or experienced greater obstacles. And so when we think about health disparities, these are sort of the buckets or the areas where folks tend to experience a lot of health disparities. It could be with gender and age. It could be sexual orientation and gender identity, physical disabilities, geographic location. I know that working in Ohio, we were blessed to be able to get the 5th PFS. And the last time that we did this work, we specifically focused on our Ohio rural and Appalachian areas because of in 2009, when we experienced the recession, there were so many services in behavioral health that got cut off. So that became a big deal for us, was taking a look at the populations in geographic locations. Racial and ethnic groups, we know this to be true, that not everyone has equal health, outcomes when it comes to racial and ethnic populations. So again, health disparities are all about the presence of disease and health outcomes. And it's, between population groups. So I want to throw in a couple more words here. So sometimes you hear disparities. Sometimes you hear about inequity. And sometimes you hear about inequality. So basically, health disparities and health inequalities, they're really the same thing. One of the things that's important to understand is that now we're starting to talk about health disparities that are based on social inequalities. And because there are these variations in health outcomes, so we know when we talk about things like health outcomes, we're talking about morbidity rate, infant mortality rate, life expectancy, and we know that those are different across different population groups. I know that many of you are probably familiar and either are part of the work in your individual state with the fact that there's huge health disparities in African-American communities when it comes to the infant mortality rate. And so that's just one example of a health disparity. This is something that I feel like we're working on nationwide, that everyone is really concerned about this issue. But there's lots of other inequalities that are based on health outcomes, and you'll see variations, based on racial and ethnic and all the categories that we talked about in the previous slide. So, again, what are we talking about when we're talking about health inequities? And I think a lot of times we immediately think about, there's differences in this population. Well, people need to learn how to eat better, and they need to learn how to exercise more. And so, again, we want to make sure that we're not blaming individuals and communities for things that are out of their control. And there are certain things that are out of their control. And so when it comes to health inequities, these are differences that are really unnecessary and avoidable because they're unfair and unjust. And so a lot of these differences and these health disparities and inequalities are rooted in social injustices. And the bottom line is that there are just some population groups that are more vulnerable to poor health than others. So if you think about some of the previous slides, what we talked about was typically, the lower a person's social position, the worse their health status is going to be. We talked about the lower in education a person may be educated, they may not be able to have a longer life expectancy. Again, it's not about blaming the victim for poor health status, but it's also about understanding the picture, understanding that it's about the context and how money, power, and resources really interplay when it comes to these things. So we've talked about health disparities, health inequalities, health inequities, and ultimately the place that we want to move to is health equity. And health equity is when everyone has the full potential and opportunity to obtain good and optimal health. And so this is irregardless of social conditions, irregardless of the social injustices. And so what we want to look at is everyone, again, having the opportunity. So with this, we're also looking at the absence of systematic disparities, and we want to make sure that we're addressing those issues and addressing those issues that are social advantages and disadvantages that are the underlying, again, when we talk about the causes, the root causes, the causes of the causes, all those other pieces in terms of different positions in social hierarchies. And so, again, it's all about achieving the highest level of health for all people. This is one of my favorite images when I like to think about health equity and health equality. And it's important for us to know that it's going to take all of us. We can't depend on just public health to do this. This is why preventionists are we're in the perfect area to do this work because we've been doing this kind of work. So it's going to take focused societal efforts to address these inequalities and to really try to equalize things for those that have experienced historically injustices and disadvantages. One of the things I think is interesting, and just to give you an idea of how important health equity is and this whole idea of social determinants of health, how much we've grown over the past few decades, is that in the beginning, Healthy People 2000, their goal was to just reduce health disparities among Americans. We want to reduce health disparities. But then in 2010, it was to eliminate the health disparities, not just reduce it. But now in 2020, we're saying we're going to expand this goal even more, and we want to achieve health equity, eliminate disparities, and improve the health of all groups. Again, all of us being focused on the fact that we recognize there are just some population groups that are experiencing disadvantages more than others. I just wanted you to see another image. I think sometimes, even though I'm talking and have different talking points, I know this is one of the images that you've probably seen before. People love this image, and I do too. Sometimes we just need to see it, the difference between health equality and health equity. So I just want to tell you a little sort of story. So imagine for a moment that wherever you are, we are all together. Let's say in one big room, we're all together, And I have the great ability to be able to gift every single one of you on the call with a nice, brand new pair of gym shoes that are the latest that Nike has to offer. And so everybody, I get to be Oprah here. Instead of a car, everybody gets a pair of gym shoes. Every single one of you gets a pair of gym shoes. The thing is, every one of you gets a size 10 gym shoe. Everybody got a pair of gym shoes, but they're all a size 10. And so I love this example because just because I gave everybody the same thing doesn't mean that it met everybody's needs. So I can be Oprah all day and give out, gym shoes for everybody. But it's not about equality. It's about access to the same opportunities. And so I love that example. I'm looking at the chat box and I'm seeing some great things. Someone mentioned that it was just like the stimulus example. Great example. And so it's not about giving everybody the same thing. That only works if we all start from the same place. It's about access to the same opportunities. And as preventionists and folks in this fight for health equity, it's important that we ensure that we can only ever enjoy equity. We can't have equality without equity. It's just not, it just doesn't work. So just another image that I like to use because I think we all learn differently. And for me, it really helps to see different images. I love this. And it just helps us to get the point across. So the next thing I want to talk about here is that the truth is that race matters. Race matters. And so in order for us to begin to really think about how we can best work with people, we have to first acknowledge that racial and ethnic backgrounds matter. We have to confront and acknowledge that history before we can begin to eliminate health disparities. We have to understand that our nation has been full of blatant discriminatory policies that have made it nearly impossible for people to have good health. And this isn't new. This, it has started long time ago, redlining, all kinds of different things. And so we want to remember that the role of racism, discrimination, and bias have perpetuated generational cycles of poor health and risky behavior. Again, remember we talked about the fact that how these things can impact health. So if you're constantly being discriminated against or people have biases against you, that leads to stress, unfair treatment in the workplace, high blood pressure, heart rate, you name it, stress. All of these things are going to lead to unhealthy behavior. And so I think it's really important here because people get nervous when we talk about race, but race is a huge part of public health and in leveling the playing field. And until we start having some uncomfortable conversations, we're not going to move the needle to equity. So again, we want to think about the social determinants of health, and it's all about an individual's place in society. And we have to be honest about the fact that experience of discrimination and historical trauma are key when we're talking about these things. So now it's time to share a little bit. I hope that some of you had an opportunity to think about what makes up who you are. Back to that first slide. Who are you? How would you describe yourself? So if you have a moment and you'd like to share, I'd really love to hear from you to see, how did you describe yourself? Go ahead, type into the chat. I'll read out some of them. How did you describe yourself? What defines who you are? Someone said Generation X, wisdom, single female, parent over 55, race, culture, baby boomer, my hope and purpose. I love this. Someone says, some of my experiences. Grew up in rural community, single working mom, psychologist, mother, wife, grandmother, millennial, daughter of God. Empathetic, age, my relationship to others, woman with a soul, resilient, first generation, hard worker, partner, work ethic, gay, non-binary, first generation, college student, encourager. Oh, I'm seeing this. This is great. Latina woman, professional, a helper, person with integrity. Again, child of God, my purpose, empathetic, Black single female mom, community advocate, compassionate. What's interesting to me as I'm looking at this, mentor, is without even realizing it, you all defined yourselves in terms of the social determinants of health. You defined yourself in terms of that before we even got into the discussion. Not one person on here said anything about, my genetic makeup or anything. You're talking about, someone says middle-aged white woman working remotely from upper-class suburb in a top-tier school district surrounded by privilege, prevention professional. This is the context of your lives. This is the context of your lives, people. And this is what's important for us to remember when we're working with folks and we're talking about seeing people for who they are. It's not just about the person that walks through the door. This is a shift. This is a shift in how we traditionally think. We traditionally think, let's say, we get girl A that comes to our prevention programs, and what we see on the outside is what we think we get. No. We have to begin to think about folks in the context of their lives and all the things that could be happening. So, yeah, this is great that I got this young person in my life skills, but do I know anything about the context of their lives? And is this life skills course really impacting them if they're going home and they live in a food desert and the closest thing is a 7-Eleven? Probably not. So this is an opportunity for us as preventionists and really to work alongside with everyone else to shift our thinking a bit from this focus on disease. This focus on disease. I got to fix the person that comes through, or I got to help the person that comes through the door, or I see them as their disease. No. People are much more than what they present themselves through the door. You showed that here today. And first of all, thank you. Thank you for being so honest. Thank you for being so honest about who you are and sharing that, because you did not have to share that. But it just lets us know that we're so much more than what people see through the door, than our biology and our genetic makeup. And that's the way we want to begin to think about how we work with others. So, thank you again. So, quick review. Again, the social determinants of health. We look at things like economic stability, social and community context, neighborhood and environment, healthcare and education. And remember, I said that I started looking at more research that adds another one there that says food. I've even seen another one there that adds race, and another one there that adds ethnicity. Again, I don't want you to get caught up in, okay, I need to remember the 5 areas. I just want you to know that these are the things that determine the context of a person's life. And these are just sort of buckets and huge areas with lots of interrelated factors. So, as we think about the social determinants of health, sometimes I know as preventionists, we're always like, I feel like we're the first to the race. We're always signing up for the do-good type of thing. And so where do we begin? Sometimes we overwhelm ourselves. And so that's one thing I don't want you to feel when you leave here today. I don't want you to feel overwhelmed. We're just going to take it a bite at a time. And so I think one of the first things we have to do is we have to learn the language. Because the funny thing is, whenever people come to our prevention field, what's the first thing they complain about? Oh, my goodness, You all have so many acronyms we have to remember, which is true. We do. We have a lot of acronyms. But it's important for us to be able to learn the language of others, which is why I did just sort of a really quick and dirty about health disparities, health inequalities, health inequity. Know that you will hear these words used interchangeably. And I think the main thing you want to remember is that it's all about differences. It's all about differences and the fact that these differences aren't always, it's not necessarily related to biology and genetics. It's related to the social context of people's lives. So that's the first part. And I think we did a good job of that today. That's the first part. The second thing is, I think one of the things we could begin is utilizing our community wheel. Now, all of our community wheels, basically, they may look a little bit different, but we kind of have the same things. We always say, don't we? When we want to do a project, especially if it's a community coalition, or we want to work with someone, we're like, we got to get education on board. We got to get the faith-based folks on board. We got to get businesses on board. So think about our community wheel in terms of prevention. Let's just think about that. I feel like there is nobody positioned better to do this work and to push it through and to start being an advocate for it than prevention people. So think about the community well in those sectors. And while there's lots of sectors, I don't want you to feel like you have to do something in each one. Just focus in on one area. Where could you build on an existing partnership? Where could you start to build that capacity? Start reaching out to your health partners. Your public health partners, they've got lots of information. The thing about public health is I feel like I have the benefit of living in both worlds. I started out, in community health and became a preventionist, and I'm still in public health. But I will admit to you that both of us have the same goal, and it's health communities, and rarely do we talk to each other. But I think we're getting better at this. I think we're getting better because it's forcing us, these issues are forcing us to work alongside of each other. Health departments have great data. We're really been encouraging a lot of our communities in Ohio to work with their health departments. So reach out and then think about what's your contribution. What can you contribute? Because somebody always wants to know, well, what am I going to get out of this? So that's where we start. Let's just take it like the old African proverb says, how do you eat an elephant? One bite at a time. Just take it one bite at a time. So what I want you to think about today as we're closing, we have a few minutes left, is I really want you to think about just two ways, just two, that you can begin to initiate connections to the social determinants of health and what you're already doing. And I'd like for you to share that in the chat box. First of all, thank you for being so willing. I mean, this chat box is like on fire. So thank you. Just think about two ways that we can begin to initiate connections on the social determinants of health. Just two. And I see that Michael kind of has a bit of a question. I think this is very good, Michael. I would value hearing about how prevention organizations were successful in impacting the social determinants of health. Can't quite envision how our county-based prevention coalition could impact it. All right, so here's some suggestions. Keep advocating for clients as we provide services for them. Yes. Volunteer in the community to build relationships that will tie back to my organization. Yes, that's awesome. Apply my lived experiences as a recovering addict and alcoholic. Yes. Somebody said, makes me feel small. I wish I could make more of a change. Don't feel small. You can make a change. And it doesn't have to be a big change. Having reading mentors, yes. They're starting to come in so quickly. Learn the community's needs, yes. Apply my ethics. Support groups and presentations, oh my goodness, they're coming in so quick. Reduce stigma. That's a great way to get involved. Strive for a diverse coalition, yes. Accept others unconditionally. Give resources and languages of the community. That's a great one. That is a great one. I see taking charge of my own health and keep pushing against the barriers. Provide culturally competent information. Yes, I think a good example of that was the language pieces too. Being open to others' experiences, both. right. Find the community leaders. I think that's key because you want to be able to start those relationships, meeting people where they are, not judging. Yes, engaging the community to identify needs. Yes, so don't come in the community ready to solve all the community's problems without identifying the needs and including them at the table. Stakeholders, yes, I love this. Engage community to identify needs, whether it's street lights or safety or food. Remember, all of those things are part of the social determinants of health. Yes, being a person that the community can trust. Yes, your word is very important. If you say you're going to do something, it's important that you follow up and do it, or otherwise it's better that you just don't say you're going to do it at all. Listen. Yes, there's lots of opportunities to listen. People have a lot to say, and so you want to be open to that. Photo Voice Project is very beneficial, striving to understand differing perspectives. Very good, very good. Sharing your own experiences as a Latina in the community and helping to connect other minorities. Excellent, excellent. Finding value in adding collaborators. These are all really, really good. And I just want to say thank you. Thank you for being so open to sharing this, and thank you for sharing your experiences. Oh, these are great ideas. Access to clean supplies. Yes. I just want to say thank you for your time today. I know that we are going through a hard time, but we will get through this together. And I just thank you for your attentiveness. And I just want to thank you for participating in the chat box. Thank you so very much. It was amazing to spend this afternoon here with you today. My contact information is there. Please feel free to contact me if you'd like to have further conversations about this. I'd love to have conversations with you, and I'm open to that. Thank you again to the PTTC for having me, and have a good afternoon.
Thanks again for joining us today, and thank you to our engaging presenter. For more information about the Central East PTTC, please visit our website or send an email to Deborah Nixon Hughes at dhughes@danyainstitute.org.